Hello, hello. Welcome, everybody, and thanks for joining us today as we chat about how we can manage chronic and acute pain naturally with the through the art and science of chiropractic care. So we're really lucky today. We have Nick Bosse from Waterville, Maine, to chat with us. We have a lot to cover in a very short period of time. And we're going to touch on some very important topics from the opioid crisis and how, like, the mechanics of natural pain management. Nick will probably talk to us a little bit about the philosophy of his work and dig up some success stories to give us some hope. And I know Nick wants to give us some self-care techniques, a couple things we can do at home to kind of help if we're struggling with chronic or even acute pain. All right, so Nick Bosse is from his office is here in Waterville, Maine, and it is Bosse Family Chiropractic and Wellness. And I've actually had the pleasure of knowing Nick on a personal level and as a friend, and we initially met as members of the same CrossFit community here in Waterville, Maine. He's one of the hardest working members there, and he came in working as an athlete. He's gone on to be a leader and a coach in the community. So he has a really strong passion for helping people work through their own physical challenges and take their health and fitness to the next level. And I've seen him do that with his own health and fitness. So it's really exciting. And as a healthcare provider, Nick and his team represent a community-based healthcare model in which they support their clients and their overall health rather than just managing symptoms. So this type of care, in our opinion, represents the future of healthcare in America. It's a healthcare model based on compassion and supporting the body's ability to heal. So welcome, Nick. We really appreciate you taking some time to chat with us today.
Yeah, no problem, Steve. Thanks so much for the opportunity, and thanks so much for those kind words. That was quite the intro. Very humbled by that. But thanks for letting me join in on the show here.
Yeah, sure thing. All right. Well, Nick, we want to cover a lot of stuff, and we have a very short period of time to do that. Everybody's busy getting ready for the holidays and everything. So, let's talk real quick about the philosophy of chiropractic care and how you treat a client versus how most people are used to being treated within the conventional healthcare system. Because what we're talking about with healthcare is kind of outside of this very small circle of healthcare providers that most people are used to, where you go and you get treated with drugs or surgery, and you see a doctor for a couple minutes, and you're off and out the door on your own. So what's the philosophy behind your healthcare model, what you're doing with patients?
Sure. So in a few words, so chiropractic is a form of healthcare that's focused on disorders and other problems of the musculoskeletal system, and then somewhat connected, or definitely connected, the nervous system. And the vast majority of problems that people are going to encounter in their lifetime are going to likely be musculoskeletal, because it's a very large system in the body and it's got a lot of moving parts. So we as chiropractors treat that using a variety of methods. We're centered upon what is very commonly known as joint adjustments or spinal adjustments, also known as spinal manipulation. And these are just basically high velocity, so very quick, but low force, low amplitude forces that are applied to a joint to improve its motion and ultimately improve its function and how it interacts with the rest of the tissues in one. The end result is often for people to feel better, recover faster from an injury, get out of pain faster, and then ultimately not have a need or dependency on over-the-counter or prescribed pharmaceutical drugs. So it's an all-natural approach, going back to what you were just talking about there. So we don't deal with drugs or surgery or anything like that, unless it's really, unless we've exhausted all other options that are conservative in nature. So joint manipulation, exercise, rehab, all those different things before we go the route of pharmaceuticals or surgery.
Yeah, and I think that's a great point, because if there is a place for drugs, I think it would only be after everything else has been exhausted. So I appreciate that you mentioned that, actually trying something else first. Now, I think when most people think of chiropractic, you like maybe you throw your back out or you slip on the ice, you feel injured. But isn't there a bigger potential for chiropractic to help people with all kinds of ailments and chronic issues that aren't necessarily just pain related?
Yeah, sure. Us as doctors, we're trained very much in the same way that a medical doctor or a doctor of osteopathy might be trained. We have a similar amount of clinical hours in terms of dealing with nutrition, as well as pharmaceuticals and pathology. So we can often help with diagnosing and then maybe co-managing other conditions that might not be musculoskeletal in nature, but might have a musculoskeletal component. The big one that I see a lot of, for instance, would be type 2 diabetes and the different types. So that's a lifestyle-driven component. We know that. There's a lot of different factors there, but a lot of the symptoms can include things like chronic pain, joint pain, things like that, and we can help in co-managing that alongside another team of other providers, hopefully like-minded providers that are consulting. But a lot of chiropractors will talk about nutrition with their patients. They'll talk about exercise. That's part of why I'm really big into CrossFit. That's my prescription of choice, if you will, when it comes to fitness. But yes, we are primary spine practitioners or specialists, you might call us. But we do offer, depending on the different specialties out there and other interests that each individual doctor has, we certainly can offer a lot more to the patients. So I myself am really focused on the musculoskeletal side of things, but I often will talk about nutrition and diet and other lifestyle factors with my patients, just because it's good practice to get them educated and informed about the different effects those kinds of conditions have and how they can be affected by diet and lifestyle.
Yeah, absolutely. And I think, like you were talking about by addressing the nervous system, that's something a lot of people never even consider when they are ill or whatever. But I see we actually have a lot of people coming in on the broadcast here, and we are going to open this up to questions, but I would just want to welcome everybody. Actually here, we don't actually have to wait, but welcome, Elaine. Thanks for your question. What about?
Oh, this is cool. Yeah.
Yeah. So what about rheumatoid arthritis?
Yeah.
Chronic pain.
So chronic pain specifically, and certainly rheumatoid arthritis is an inflammatory condition. That's a specific type of arthritis that involves inflammation of the joints and does cause chronic pain. And chiropractic manipulation, in conjunction with other therapies, was shown to be a great first line of defense or first line therapy for folks that are dealing with chronic pain before jumping into the pharmaceuticals. In fact, that comes out of in this year, the clinical practice guidelines from the American College of Physicians, which is the governing body, if you will, or one of the governing bodies for medical doctors, to recommend to their patients. They just added chiropractic care to that for a variety of chronic pain conditions like rheumatoid arthritis. So physicians now are being instructed by educational bodies and things like that to, if you have a patient that's coming in with, for instance, as the question of rheumatoid arthritis, if you have a patient coming in with that, then you really ought to be trying a conservative therapy. You ought to be trying something like chiropractic, or even they've added acupuncture to that as well. And also consulting on, again, diet, lifestyle, things like that. those all play a big role. So that's a great question. And yeah, so chiropractic is useful for chronic pain. It's well documented, and now a lot of big organizations and educational bodies are adding that into the mix for practice guidelines.
Yeah, absolutely. That's great, because those types of issues, those chronic, autoimmune disorders, I've known a lot of people that are facing that, and I feel for them because they're not getting a lot of solutions within the conventional healthcare model. So finding another way to treat that is excellent. So Elaine says thank you, and thank you, Elaine, for your question. So yeah, when I was doing my research, I actually found quite a bit of well, there's tons of studies out there regarding this type of care, and if you do a look actually on PubMed, let me pull this up real quick. Whoops, there we go. There's one little search within PubMed. There it is. And you'll see there's over 2,000 studies regarding chiropractic and how it can address so many different issues. So I know the topic of this specifically was pain management, how to help somebody deal with that sort of thing, because like you and I were talking, Nick, before the show here about the opioid crisis. I think everybody has had this crisis touch their family, immediately or within their center of influence. As everybody is facing this crisis of people using opioids, and I forget what the number is, but in Maine alone, there are dozens of people dying, weekly, monthly, and we want to have about specifically that. I think it's about 1 in 4 a day are being treated for something that's overdose related. I might have to pull that number up, but it was quite a bit. There's a lot of folks that are affected by it, like you said. And I believe there's probably about 1,000 cases of some sort of use or abuse or side effect issue that's coming into hospitals basically daily. So it's definitely something that we can't ignore anymore. Yeah, every day more than 1,000 people are treated in the ER for some sort of misuse scenario with an opiate. Yeah, that's way too much. All right, so we're getting along in time here. Now, I would like to also invite anybody else who has any questions pertaining to their own situation, maybe somebody that they care about, how they can be helped with chiropractic. This is a philosophy of health where, the standard of care in the conventional healthcare system is one where we're assuming the body is broken because it's not functioning properly. Obviously, something is broken, but it's also assuming the body doesn't know how to be healthy. Now, Nick, could you comment on that as far as, when you're treating somebody, how you're actually encouraging the body to heal itself rather than trying to, you're using, your techniques and your art to manipulate the body from the outside, but aren't you encouraging the body to heal itself?
Yeah, we know that we can influence our bodies, and we can then influence receptors that are part of the nervous system by doing things to our bodies that then have a positive feedback to the brain, and then the brain basically controls everything in your body. If you positively influence the brain, then the brain will correct things often, not all the time, but can certainly correct things or function or facilitate function in the body in a more healthy way. So joint manipulation stimulates what are called mechanoreceptors. So not want to get too technical, but these are just receptors that respond to movement, hence the name mechanoreceptor. And when we stimulate those, we basically give the brain a signal that says, hey, this is how we're supposed to move. This is that joint is saying, this is how we're supposed to move. And then the brain says, oh, okay, cool. Now we'll start moving. So people's range of motion gets better, and the brain becomes less sensitized to pain. And then you get out of pain a little bit faster, and then your body wants to move better as a result. So that's how it's sort of with chiropractic and joint manipulation. That's how it has an effect from the outside in, but all we're really trying to do there is stimulate a process in the body that is already functioning, and that's homeostasis. So that's that self-regulating ability that your brain and all the tissues in your body are governed by. They maintain your body temperature, they maintain your heart rate, your blood pressure, all those different things. We're just trying to stimulate another aspect of homeostasis in terms of mechanics, biomechanics. How does your body move? We have 206, give or take, freely movable joints in the body. So we have a lot of moving parts. So we're not meant to sit around, we're meant to move. So that's one big thing that chiropractic is I think, focused on is stimulating better movement and encouraging better movement, both as a whole body, as a whole person, but also in individual areas that might be painful, like someone's back or neck or shoulder or something like that. I don't know if that hits on what you were getting at there, but that would be sort of how I think chiropractic ties into, us having all of the resources we need to heal and function are within us. It's just a matter of facilitating that.
Yeah, no, I think that was a great description. Thank you. And, I know at the gym, your, mobility, very focused on mobility and in range of motion and all those sorts of things. And I know personally, because I've dealt with plenty of chronic pain myself, what happens with my my body when it's in pain is you tend to not want to move it.
Absolutely right.
So it is a challenge, and it's counterintuitive to work through that and to keep your body moving despite those challenges. So. All righty. Now, what's that?
I think a question was just popping up on the screen. I didn't catch it all though. But.
Oh, okay. Here we go. Sidue, I hope that I pronounced your name right. Welcome and thank you for joining us. Sidue asks, is doing some physiotherapy exercises at home very good for this? And maybe this is a good point to actually talk about what we can do at home. And I don't know, I'm not familiar with the term physiotherapy or how that applies. But.
Yeah, well, I mean, certainly exercise in general is going to be a great place to start. If you are dealing with acute or subacute or even some chronic pain, if you haven't started there, because that's going to be a good, if it works, then you just figured out on your own what you need to do. And one of the best resources that I point a lot of my patients to is an excellent book by a physical therapist named Robin Mckenzie. And he developed what's called the Mckenzie method or Mckenzie protocol, or we call it MDT, which is Mckenzie Diagnosis and Treatment. And it's really focused on joints, range of motion, end range of motion, specifically end range loading of a joint, because joints, he found, responded very favorably, especially in the spine, to being loaded at their end range for periods of time, meaning that they put some either some resistance in there or just someone's body weight in there. And those are all really good exercises. And the book is really it's thin. You know, it's probably about 100 pages. It's written specifically for a layperson to understand. But I've done additional coursework on it from a practitioner standpoint, and I use a lot of those exercises. And in many cases, Steve, you were asking earlier about some success stories, and I couldn't tell you how many times that I've gotten people to do one or two of the exercises from the Mckenzie method, and between their first visit when they're hobbling on in, or they're just bracing themselves in any different position to try to get comfortable, and their pain level is just through the roof, they'll come back in a day or two later and they're moving and walking in a much more normal or more comfortable way, and it's just as a result of getting them to do some in-range exercises like that. So again, the resources is Robin Mckenzie, the Mckenzie method. The book is called How to Treat Your Back, or How to Treat Your Neck, I believe, is a second book as well. And again, very thin books, easy to read, lots of pictures, and they're very simple exercises. So yes, so at-home exercises are phenomenal first place to start. And then maybe if you're not sure where to start, then reaching out to someone like a chiropractor or a physical therapist, or even an athletic trainer. Those types of folks, fitness trainers, certainly have some education too when it comes to back exercises that can help.
Yeah, excellent. Thank you for that. And the resource also, the book, How to Treat Your Back, we'll put a link to that, or I'll put a couple notes in the comments section after this video so that folks can find that. And, just on a similar note, my own success story, one time I was experiencing a really bad case of sciatica, one in which after riding in the car for a short period of time, I couldn't even stand up. I couldn't get vertical again. So I would walk around in a crooked state until I could finally loosen up a little bit, and it was so painful. But I had committed to myself years ago to manage things without drugs, so I didn't do anything except find some exercises that I could do. I found some stretches I could do at home, and I did go to a chiropractor. This was years ago, and after just a couple short treatments, and after doing that, after doing those stretches at home, it totally went away, and it hasn't been back since. That's why it really breaks my heart when I hear somebody is going in for surgery for something like sciatica. I know it's absolutely. I can only speak from my own experience, but it's probably
but that's
incredible.
That's an excellent story. And, on the topic of surgery, just an interesting fact with chiropractic, there's been a research study that followed a group of I believe they were following a big employer of some sort, but they saw a really interesting number that 42.7% of their employees who went to an MD first to deal with a back injury saw or ended up having to get surgery, having to have spinal surgery, and 1.5% of their employees who saw a chiropractor first ended up having to go for spinal surgery. So that is tremendous. I can certainly pull up the. It's a tremendous difference. I can certainly provide the research behind that, but that's just huge. I mean, half of the employees that went in to see an MD ended up getting back surgery. Half those workers, whereas 1.5% of them that went to see a chiropractor first for their injuries ended up having to go the surgical route. So yeah,
that's amazing. That's nothing to gloss over. I mean, that's such a huge. There's such a huge difference there, and I think at this time, where we're, talking about, how do we pay for healthcare and these issues, this highlights a different question. It's like, how, what are we getting for what we're paying for? You know, of course, if we have to have surgery for everything, our healthcare system is going to be so expensive, you know, versus, you know, something that, you know, a skilled physician can work you through and avoid surgery altogether and avoid the drugs. You know, those patented, you know, healthcare systems are, in my mind, what's causing the healthcare crisis. And it's actually proving to be mostly ineffective at actually helping people.
Right.
That's why we're here today, right?
No, definitely. I always like that analogy of if your only tool is a hammer, everything starts to look like a nail, and I think that really is a big problem in healthcare, because if all you really are being trained to do is prescribe or there's a drug now for anything out there. We've all seen the commercials that you can literally have any set of symptoms and there's going to be a pharmaceutical agent for it. Well, you know, our medical docs out there, and probably through no fault of their own, it's just the education and the system and whatnot, but their only tool is the prescription pad. And then if you're a specialist like a surgeon, then your tool is a scalpel. But then everyone looks like a surgical candidate. Everyone looks like a pharmaceutical candidate, you know, and that really isn't the case. You know, that these are people that have some dysfunction that can be remedied outside of, or we should at least try to remedy the outside of those two things. So.
Exactly. Thank you for that. That's exactly the kind of thing we're trying to dig up here. And so there are, you know, people within our community that can help us do that. You have to dig a little deeper. And, you know, somebody like Nick, who works within the community and has his own practice, you know, you can call, you can ask questions. I don't doubt that you can, you know, find out ahead of time if Nick thinks that you're a candidate for getting some rehab through chiropractic. And we'll put a link up to Nick's website so you can find him there. And Nick, is there anything else that you want to mention? Is there any questions that I failed to ask? First of all,
I think we covered a lot, Steve. And again, thanks for having me. And yeah, definitely anyone that is watching, please feel free to send an email our way. Use our website. Our website has a question form on it to contact us. You can also send an email to us. We also respond to Facebook messaging. We have a Facebook page. That's facebook.com/Bosse Chiropractic. The Facebook link is on our main website, so you can find us on social media that way. A lot of people do like that nowadays to just simply send a Facebook message or something like that. It's quick. We can get back to folks pretty quickly. But email also, and then of course just calling. You know, if you're local, even stopping by. If I have a few minutes, I'm always happy to talk.
All right, very good. And you said the Facebook page is facebook.com.
Facebook.com/Bosse Chiropractic. That's BOSSE Chiropractic.
All right. And put that right in the comments section so you can go there right away if anybody wants to find out more about Bosse Chiropractic and Wellness. And yeah, Nick, thank you so much for joining us today. I think this has been an excellent way for people to kind of get a little insight into what you do. And, you know, everybody just stay tuned and continue, you know, joining in the conversation, bringing your questions. And, you know, we'll look forward to seeing you soon, and have a happy and healthy holiday. And,
yes.
All right. So, Coach Nick, we'll see you at the gym, and everybody, take care.
All right. Have a good night, everyone. Thank you.
Hello. Welcome, everybody, and thanks for joining us today as we chat about how we can manage chronic and acute pain naturally with the through the art and science of chiropractic care. So we're really lucky today. We have Nick Bosse from Waterville, Maine, to chat with us. We have a lot to cover in a very short period of time. And we're going to touch on some very important topics, from the opioid crisis and how, like, the mechanics of natural pain management. Nick will probably talk to us a little bit about the philosophy of his work and dig up some success stories to give us some hope. And I know Nick wants to give us some self-care techniques, a couple things we can do at home to kind of help if we're struggling with chronic or even acute pain. All right, so Nick Bosse is from his office is here in Waterville, Maine, and it is Bosse Family Chiropractic and Wellness. And I've actually had the pleasure of knowing Nick on a personal level, and as a friend, and we initially met as members of the same CrossFit community here in Waterville, Maine. He's one of the